just by getting large numbers of people together, you're going to get people with mental illness. That's going to happen, but it's disproportionately seen in the offender population. And some research suggests that is related to the discharge of people from psychiatric wards.
In the 70s, 60s and 70s, there was a great movement to liberate people from institutions, which seemed like a good idea at the time. And the idea was you would have community health centers to follow up with people who, with medication and such, could stay out in society. The problem is that never got funded sufficiently, and there was really no way to enforce it. People who stopped taking their medications, you look at most of these serial killers, are people who have been on medication and they stopped taking their medication, and nobody really calls them up and say, hey, you taking your drugs? Or follows up on them, and they go off the deep end.
When they are first brought into prison, they are screened. So they should get a psychological screen, and so that would be, if not a licensed PhD level psychologist, someone with a master's, some with some kind of training in mental health, and they're just looking for indicators. So suicide, depression, anxiety, substance use, and then referring that person on for help. And whether they choose to take it or not is a different issue. So some offenders may not want to be going down to the mental health unit for services, and others are relieved to get away from the general population and go and see the doctor. Being imprisoned can bring on mental illness. So some of the individuals in prison might be dealing with depression and anxiety at the beginning of their sentence because of this transition from autonomy and being out in the real world to a highly regimented environment in prison. And then they say that that kind of stress tends to ease off over the sentence, but then reemerges close to release. So the offenders will start to experience some anxiety and depression at the next transition, which is going back into the world and leaving that regimented world that they've become familiar with.
Dealing with juvenile crime as well, and working with sex victims, young offenders that were missed are becoming the next set of perpetrators, where they're perping on their younger siblings or their little siblings' friends that come over because they were never helped with services. And you talking about somebody that totally gets screwed, they were abused and now they're going to be prosecuted. And they've lost on both sides. You just can't throw this kid away because he's hurt someone because he was taught to and nobody ever helped him or her.
Some individuals, this is their only chance to get access to services, and so the problem is not, are they getting it in there, it's what are they going to do when they get out.
If you have somebody who needs drugs, needs medication to stay normal, and some people do, it's like having diabetes. You're fine as long as you get proper medication. But there's very little enforcement or ways to follow up and basically force people to take their medications.
No, I think for most people, being in prison does not help the mental illness. The rare exception of some people who really would not get anything out in the real world, maybe there's a minority of individuals in that sense. So no, I don't think it is helpful for mental illness, and it can exacerbate symptoms, and sometimes the guards, for example, can interpret the symptoms as being non-compliant and aggressive, and it can just contribute to problems interacting with other prisoners.
Mental illness is a biggie, and you can't just throw somebody away because they don't act right, because they're acting based on something that has been acted upon them. And we got to be mature enough to really respect what has happened to someone and just not treat them like they don't matter anymore, because they do.
Mental health is a big problem in the prisons, and I think the focus should be what can we do to help them, and that should be the rehabilitative focus. Most academics focus on rehabilitation, and not all prisons do. A lot of it's just on punishment, retribution. Let's get this person to pay for their crimes, and while that's not unimportant, we want this person to be able to reintegrate into society afterwards and become useful if indeed they can reintegrate, if it's not a serious crime. A potential answer is if these individuals are committing crimes, maybe a focus on rehabilitation is better, which would involve community monitoring. So an individual who is punished and limited in that sense in their daily activities, but a requirement is that they attend, whether it's group therapy sessions, individual counseling sessions, taking medication, and throwing into all of that would be skills training. So depending on the disorder, it could be things like how to interact with others. It can be kind of simple like that, and how to not respond aggressively when engaging with other individuals, how to interpret other people's behavior in a non-threatening way, and substance use